Welcome to the CHC Podcast, where Community Hospital Corporation shares news and insights that affect rural and community healthcare. I'm your host, Julie Fisk. Today, I'm here with Jim Kendrick, President and CEO of Community Hospital Corporation and Texas Hospital Association Board Chair. Also joining us is Ken Gordon, CHC's Board Chair. In this episode, we're going to discuss the current political climate and state of the healthcare industry and how the environment impacts rural and community hospitals. I'm looking forward to our conversation because you both have a unique point of view on the healthcare industry. CHC owns, manages, and consults with hospitals across the country, so you both see firsthand the best practices and common challenges, issues that are facing rural and community hospitals. It's clearly a period of uncertainty for hospital executives, and more challenging times are expected. So, Jim, what actions do you see hospital CEOs taking in this current environment?
Hospital CEOs are going to have to address where their hospitals are today and where they're going to be in the future based off the impacts of the changes they know are coming. I mean, you can look at things like the One Big Beautiful Bill and understand what the implications are going to be on your hospital. Those implications are going to be varied across the country, because we have hospitals that are in states that have expanded Medicaid. We have hospitals in states that haven't expanded Medicaid. I think 41 states have expanded Medicaid and the others haven't. But if you're in a state that hasn't expanded Medicaid, then you have less of an implication, okay? So things like the pace at which the impact will occur will vary. There's safe harbors for supplemental payments that will be phased out for expansion states and not phased out for states that didn't expand. So those things are big dollar impacts. And then the other pieces are the number of Medicaid enrollees that hospitals will be dealing with and providing care for. And based off of that number of that population, it can trigger a lot of things. There's things like disproportionate share payments, that if a hospital maintains a certain threshold of Medicaid care, then they get disproportionate share payments. Well, with these cuts, they may not be getting a cut in the actual Medicaid payment for the service provided, but they may have fewer people they're able to provide the care to. In doing that, it could trigger them not receiving those supplemental dollars. So they have to understand and get a deep, thorough understanding of the financial impact of what's coming, and then understand where their organization is going to be positioned to deliver as much quality care as they can with those new limited resources. Because that limited resource is an impact that everyone's facing. Now, I think one of the things that good CEOs are going to be out there doing is saying, all right, I know that I'm here today, and I know this is where I'm going to be next year. This is where I'm going to be in 2 years, 3 years. Again, it's a multiple phased-in issue. But with those changes, they're going to have to explore things like partnerships. So alignment with another local facility that may be 30 miles down the road, 20 miles down the road, and say, all right, we're both in this situation. Can we collaborate, come together and meet the needs of as many people as we possibly can? Because we don't have the resources to do this on our own anymore, but that partnership model may afford them the opportunity to do that. Also, in the rural hospital market, you're going to deal with things like the supplemental dollars that the government has put in place. There's a $50 billion fund. Okay, that $50 billion fund is targeting the rural market, but even in that fund, it's broken up, and half of those $50 billion will be directly sent to the states, and the other half will be left with CMS for CMS to determine. But again, that's phased in over a 10-year period. Okay, so you're talking about $5 billion a year for 10 years, and you're talking about half of it going to the states equally, and then the other half being allocated by CMS based off of organizations asking for dollars. So hospital CEOs are going to have to work with their associations, they're going to have to work with their political leaders of their state and say, these are critical needs. These are the implications that we're going to face because of these reductions in reimbursement. So with those reductions in reimbursements, these are the things we know are going to go away, or know that they're going to be threatened to go away. And if we don't want that to happen for our state, the state political system and the state associations have to be armed with that knowledge so they can go to battle for you. And in those cases of those supplemental dollars in the rural market, that other $25 billion that's at the CMS level, they can be asking for help in that specific area.
Now, Ken, speak directly to the hospital executive. From our conversation, what are the two most important takeaways or action items for hospital leaders to put on their to-do list?
Great question, and I'm going to talk about, if it's okay, to the hospital executives and the board chairs, because as I'm a board chair, the first place to start is with the leadership. We need to take a step back, assess what's going on, and plan for the future. Jim outlined what's going on with the new law and things that are going to be coming into effect over time. So we have a period of time right now to stop and think about what's going to be best for our hospitals, what's going to make a difference as we go forward, what's going to allow my hospital to thrive, not just survive. Make those decisions, put plans into place, implement them, and you need to use leadership for this. It's not just management, it's not just bouncing between doing this and doing that, not reacting in crisis time, but indeed thoughtful forward process within your team. And tightening the team, tightening the culture. The culture of the organization will carry through in a big way. And then always remember, it's quality. Our people are coming to us for healthcare, and we have to keep the main thing, which is quality and that healthcare service.
Okay, Jim, now I'd like to talk a little bit about the changes at the federal level. Can you explain how funding reduction, program elimination, and structural changes contribute to the challenges that impact rural healthcare?
Sure. So a lot of times when you look at the delivery model in a rural market, you have people doing multiple roles and multiple tasks. So if you have a program that's lost, you may be losing resources, but those resources may be the tool that you're able to do other things. So the impact that you see coming out from the changes in the federal government is predominantly driven by changes in reimbursement. Less dollars are going to come in the door. So if less dollars are going to come in the door, then that's going to change your overall delivery. Sometimes you have to look at services and say, we're losing money on providing this service line, but it's a critical need to the community. So the community has to say, all right, we know that we lose by providing this service, but we can't afford to lose it, so what are we going to do? So I'll get a good example, that's labor delivery programs, okay? Probably 50% of them across the country in rural markets have closed. Well, they closed because they were losing money. Well, if you look at it and you're in a market where you were doing 1 delivery, 2 deliveries a month, then maybe that delivery is going to go somewhere else. But if you were in the 15 to 20 deliveries a month and you've got a long way to go from a community to get to the next level of place that could provide that care, the next hospital that could provide that care, then you might say, well, we've got to subsidize this. We've got to make this work. Well, you have to quantify that. A good leader doesn't just say, well, we're losing money on this. They quantify the understanding of, all right, to have this program, it costs us $1 million a year. Well, our bottom line right now is $1 million a year, so we're break even if we continue to have this program. Well, if that's the case, then once you've quantified it, you may go out to your community and say, hey, our OB program's at risk if we don't get some help. Now, many rural hospitals are surviving because they have a tax base. So maybe that's articulation to the voting members of your community that voted in that tax base and say we may have to have an increase in that tax base to support this program. But again, they're not just going out and saying, hey, we need more money to support our program. We need additional dollars because we want to be able to maintain this delivery of care in your community. And those kind of messages carry more weight than simply saying, we're losing money, we need help. You frame it up so people understand the magnitude of what's going on. And then also, again, I touched on this on my earlier answer around Medicaid. Medicaid, for the most part, does not cover your cost of the services, but it is, if you think about it from a fixed cost perspective, it's covering some of those fixed costs. So even if you're losing money on something and it goes away, you're losing the ability to cover those additional fixed costs. So it has implications on your total program delivery as a whole. So again, it goes down to a good executive team is going to understand the complete ins and outs of their finances, the things that are going positive, what are the drivers that are giving you a positive margin, what are the ones that are neutral, what are the ones that are giving you a negative margin, and looking at that total portfolio of services. And as things are changed by the ability to fund them, you have to make decisions. You have to make hard decisions, but it's important that you make informed decisions where you're taking it to a local board or you're taking it to a local taxing district that's funding you, and you're articulating what's going on. So they don't just think, oh, well, you're not managing well, so you need more money. That's not the case. I think probably rural hospitals are probably many times managed better because they're having to do it with less resources. But that challenge is always going to be best served when you articulate the details behind it, and the details behind it coming from understanding your data and understanding your population that you're serving.
Well, there are certainly issues, but Ken, are there any bright spots in this current environment?
Oh, I'm so glad you asked that question. I'm one of those people that thinks challenges are really opportunities, and we need to approach this way. So we have leadership in place, and leadership is what's critical at this time. Not just management, not just doing, not just bouncing between different strategies or ideas or tactics, but an overall plan. And with that, we have this time to do that so we can take that forward with good leadership to make that happen. There are also opportunities to do various things that we really couldn't be doing before. So CHC is right now under process of building a hospital in rural New Mexico using tax revenues that were set aside by the state, putting that together. Jim talked about partnerships, setting up with an affiliation with a hospital in the larger community nearby. So that area will be served in a way that's better than it's ever been before, and that's even happening during these times. I mentioned earlier, I've been around in healthcare for a long time. We've always had challenges. We've always had issues, and frankly, they always turn into opportunities. So it's a matter now of finding those opportunities and taking advantage of them.
Jim, Ken, thank you so much for providing insight on these important issues. Healthcare certainly affects all of us. Also, thanks to everyone who joined us today. If you would like more information about issues facing rural and community healthcare services, take a look at the news and insights available at chc.com.